If we look at Massachusetts now, we see the lowest uninsured rate in the country, a state commission that is at least trying to continue to tackle the cost issues, not a lot of resistance to the mandates that were in the law. The society, the social fabric of Massachusetts seems to have evolved along. And of course, all of Massachusetts was a template for the Affordable Care Act. How do you look back on the experience of the Massachusetts reforms now? How do you look at that as you look back on your own experience as governor, helping to shepherd that along?
Well, I'm proud of what we did and believe that by virtue of what we did, we helped save lives. And what we did, as you know, is we expanded private insurance, not government insurance, but private insurance to the people in my state who were uninsured. Now, we had some unusual circumstances in Massachusetts, and what we crafted was crafted with those unusual circumstances in mind. So, for instance, in my state, the legislature had long ago passed laws requiring all sorts of mandated coverages. You really couldn't buy a stripped-down catastrophic care plan. You had to buy a gold-plated plan. And so as a result, Massachusetts health insurance was the most expensive in the nation, and still is. And so I recognized that when we said we're going to get insurance for everybody in our state, we would be getting them those same gold-plated plans. Now, I tried to eliminate that. I vetoed that provision in the law, but it was overridden by the legislature. But that being said, Massachusetts had this very expensive gold-plated insurance, and so when we put our plan in place, nothing changed for the 93% of our population that already had insurance. They already had those gold-plated plans. They're already paying all that money for those insurance policies. Now, when you apply that same idea to Texas or Florida, where people don't all have gold-plated plans, and then you demand, as Obamacare does, that everybody gets a gold-plated plan with all sorts of mandated coverages, premiums are going to go through the roof. Because now you've got all, the policies have to include a lot of things that people didn't want. And as a result of that, you're going to have, I'm sure you're going to have some politicians say, oh, look, the private sector, their premiums are going up so much, they're all making a ton of money. Isn't this terrible? Well, the real reason premiums are going up is because people across the country are being made to purchase plans that look like Massachusetts plans. Those high, comprehensive, mandated coverage plans. So my own view when I was running for president was straightforward, which is let each state craft their own plan to get their own people insured in the way they think best. And if people want to copy what we did in Massachusetts, fine. If Vermont wants to be a single payer, let them try. If Texas wants to put in place a plan that has health savings account oriented plan or a catastrophic care plan instead, let them try that. If a state wants to use clinics as a way of providing care for low-income folks, let them try what they will. Their objective will be to get everybody insured, to cover pre-existing conditions. But don't put in place Massachusetts insurance requirements on the entire nation. So I'm proud of what we did for what it accomplished in my state, but recognize that what's happening at the national level is going to be a problem for a lot of people. A lot of people lost their insurance that shouldn't have, even though that was a promise not kept. A lot of people are going to see their premiums go through the roof. And I know what's going to happen. Politicians are going to say, oh, you see the private industry causing premiums to go up. We need a public option, which they'll subsidize. And then they'll say, gosh, we need a larger and larger private option. I'm concerned about them trying to move to a single-payer system. There's some who haven't given up on that. So I'm glad we did what we did. I wish people would have listened to me when I said it's right for Massachusetts. It's not something which should be adopted by the entire country.